Hey guys, welcome back to another episode of Perfectly Imperfect. I'm Vanessa Liu,
I'm Adil Rana.
and today we have a special guest with us,
Would you like to
Zeeshan.
introduce yourself?
Yeah, my name is Zeeshan. I'm a first year medical student at MSU COM, and I'm very excited to be here today.
Okay, cool. We're excited to have you.
First question that we wanted to ask you is, um, well, you already introduced yourself, but can you tell us more about how your background kind of associates with mental health as a whole?
With my background as a medical student, I'd say mental health is a very commonly discussed topic, and it's not just because we're trying to be doctors. It's also because a lot of medical students struggle with mental health because, of course, it's a very rigorous program. You're going to be really pushed to your limits in each unit that you do. And so mental health, it's a common discussion of, know, how do we learn how to balance medical school with everything else we want to do in life? And I think that's a big component of mental health. Like, are you being restricted in some form of your life? And is something not really going your way? And that can really lead to, maybe a lower mental health status. So it's a common topic that I have to discuss with my peers, with other aspiring medical students, and then also just with myself. You have to make sure that you're taking care of yourself, seeing how you can regulate your own mental health. Um, and I'd say that's the biggest component of it in my life on a day-to-day basis. Of course, in our first year, we'll go through different units, such as the last unit was psychiatry, and that's all about mental health, correct? And we'll probably continue to learn it in an academic sense, but that was also just some background of how it relates to me in a personal sense.
That was perfect.
Just so we can know you a little bit more, can you talk about what specifically you want to study and the specialty you want to go into?
Yeah, of course. So I am choosing between endocrinology and pain medicine. As growing up, I was very heavily interested in endocrine. Endocrine is very cool because not only does it have to deal with people with the typical chronic diseases that you think about who need medical treatment, such as diabetics or thyroid cancer, or like people with hypothyroid. It also has to do with the obese population. And the population with obesity, we see that within all of our first of all, the whole American population. I'm sure you both come from ethnic backgrounds. We have a big problem deal, as you know, in our South Asian community with obesity. And then Vanessa, where are you from?
Vietnam.
Vietnam. I'm not sure if there's a large obesity problem there, but I can tell you with a lot of social groups, with a lot of minorities in America, obesity is a very prevalent problem. But we never really recognize it as a chronic disease. And growing up, really involved in fitness, I used to be a personal trainer. I've always recognized obesity not as something as simple as putting down the fork. So it was a personal interest for me. Additionally, with also treating people who have hormone dysregulation, such as diabetics. But my brother and sister are both diabetics. They're both type 1, and my father's a type 2. And so I had a lot of exposure to individuals with these different chronic diseases, also working in endocrine clinic for 2 years. But coming into medical school, I started thinking a little bit more. And I also want to think about myself. I want to think about who can I emotionally empathize with the most because, of course, I can look at my siblings, I can look at my parents, I can look at my South Asian community that struggles with obesity, and I can maybe sympathize with them. I can maybe like feel bad for them, but you don't really understand them emotionally as much as someone else who's had diabetes, obesity, right? But for me, what I've had is that I've struggled with chronic pain for the last 3 years. And because I've been in a position where I know exactly what my patients are feeling very often, I was thinking maybe this might be something I want to see in a clinical context too. So endocrine because I've had a lot of exposure to it. I've also been interested in it personally with fitness, um, but pain medicine because it might relate to my story more.
Can you talk more about how, obviously you know a lot about hormones. Can you talk about how that plays a role into your behavior and also your cognitive and mental health?
I'll say this. I'm very spared myself with proper hormone regulation, but I can speak for um, medical students in general that hormone regulation is so important. The number one things you're always going to hear is like insulin and glucagon, right? And the medical school population, a lot of us are unhealthy, and a lot of us might prefer to take out take out foods instead of eating our own home cooked meals. Because who has really the time to do that? You know what I'm saying?
Like that.
And of course, with go
I
ahead.
feel like that also could be applied to like different cultures within like the type of food that you receive. And I feel like that is also connected to what you say that it does range from different cultures as well.
hmm No,
So
yeah, it does. I mean, with the South Asian culture, carbs are like such a big thing. And me and you, Adil, we're Muslims, so we consume protein a lot. We'll have a lot of meat. But for the South Asian culture that's involved with maybe a Hindu background, a lot of the Indian population is all Hindu. A lot of them don't consume meat. And so the main basis of your foods is going to be simple carbohydrates. And of course, I'm not saying that the vegetarian diet is bad for you per se, but you may be prone to higher blood glucose levels and, dysregulated insulin sensitivity if you don't recognize that you can't just not pay attention to what you're eating. And that's very easy to do, especially if everyone around you is eating in a specific way, you're going to follow that same exact way. But going back to the medical school context, last semester I was ordering out all the time. I would DoorDash. It's so easy, if you have only not that much time to cook food and whatnot, because it does take a little bit. If you press that DoorDash button, you have no work to do, right? But then the bills, money's not unlimited. And of course, you can take out as much loans as you want, and then you can pay all back later. But still, it's just not a good practice. Last semester, I definitely was doing that way too much. And I even noticed in my undergrad career, my A1C, it didn't necessarily go too high, but it did elevate. Is if those who don't know what an A1C is, it basically means your blood glucose levels are high. And glucose is sugar. And you can just imagine that, okay, you're probably just consuming too much sugar day to day. And sugar isn't just like your candies, it's also like any carbohydrate. So when I was eating out all the time in my undergraduate career and my A1C was going up, you're going to feel some type of way. With elevated blood glucose levels, you're going to be irritable, and that contributes to mental health a lot. So I found that having a healthy diet, it's not only just for the aesthetics, as we all see on TikTok, it's also, and not even just for your own physical health, just not taking medicine. It's extremely important in your psychological status because irritability, you're going to be irritable with all the knowledge that you have to learn. So it's best to control that with a proper healthy diet, and that goes into hormonal regulation.
No, yeah.
We also learned, I don't know if you knew, but we also learned, we're both in AP psychology, so we also learned on how carbs tend to increase, I don't know, I think it was serotonin possibly, but serotonin. So that could like also potentially be a reason as to why so many people who are obese tend to do it or why people tend to eat a lot of carbs and
Yeah, 100%.
also is pretty explainable
Mhm.
as to your situation and everything as well.
Yeah, it's a good feeling to eat carbs. Like think about any carb around you. If you look at the carbs around your house, you're not going to think of the grains. You're not going to think of white rice. You're going to think of every other carb, maybe like candies, sweets, something that keeps you satiated, something that keeps you happy. And it's definitely something that you have to pay attention to when you start prioritizing school as much as you have to later in your career.
So, just curious, where did you go for undergrad?
I went to Wayne State. There's a
Okay,
university in Detroit.
cool. So, throughout your, academic career, how have you dealt with burnout and other like mental health problems? Because I know with school, especially in medical school, you probably worked so hard to get there and you probably studied a lot. So, how were you able to balance your mental health and academics?
I did a pretty poor job at it. When I was in pain, for background, it was a sports injury. And it just kind of lasted a while due to improper mismanagement. So the last 3 years were pretty bad. I didn't manage it well. I would sleep like in undergrad, it was like 5, 6 hours a night. I would be in so much pain sometimes, or I would lay down and I would sit down in the middle of campus because my back would hurt too much, and I would wait for someone to find me, and I'll be like, all right, we're just gonna wait here. So my mental health was really poor. Um, but I know that doesn't relate to most medical students or students because hopefully not everyone's in pain. Now that I'm not in pain, the biggest things that I've done, at least now, starting of 2 months ago, and definitely with burnout, is you got to have other interests. A lot of medical students, when you meet them, what's the only thing they talk about? medicine,
Studying.
right? So it's studying. It's the only thing. And that's probably the last thing I talk about now. Because when you encompass yourself with one thing, right, and nothing else, your basis of your mood is just dependent on that one thing, right? So it's really important to have hobbies and other interests. And I'm a super big fan of weightlifting. I've personally trained people, about 60 people. I've been a weight management coach at a clinic. That's what I did at the endocrine clinic. So I love weightlifting, and I do that about 4 days a week. And that I look forward to that so much. And another thing I've been doing recently is like these jujitsu classes at school, and that also just makes me super happy. So whenever school is not really going well, I can say, you know what? I'm still really enjoying my life because I look forward to other things. So that's really how I balance mental health the most. Another thing you can do as a medical student is I think about this a lot. Your friends will go like, "Oh, you gotta study all day. Oh, that's so lame." Well, what are you doing all day? You're working a 9 to 5. Many people, how many hours of the day? That's 8 hours of your damn day, right? I probably study 6 hours a day, right? I'm working less than you. And let's say there's some days I'm working more than you. At some point, this is also just work. And if you were not in medical school, you would be still doing work. So it kind of helps you accept that I'm not in a bad position as a medical student. I'm not in a extremely burnout position. I am in a burnout position, but these feelings of feeling stressed and tired can be normal for many careers. And it helps you feel okay with your situation. And now let's get to the point where you're just like, I hate this. I hate this. Like, this sucks. This sucks. It's the people around you. I felt that the most towards the end of my hemo-oncology unit. That was actually true burnout. I would stay up for 24 hours at a time. I would sleep for 4 hours. Then I would stay up for 36 hours. I drove back to Lansing at like 1 a.m. And then I continued to study until 8 a.m. I had class and I didn't sleep yet. And then I had class from 8 to 9. And then I studied from 9 to 12. Then I slept until 4 p.m. And then I stayed up from 4 p.m. to 8 a.m. the next day. That was the worst it got. And if you might be going like, hey, you might ask people like, hey, is this what this kid is saying is normal? No, I just didn't figure out how to study for a while. Even in those moments when I was so burnt out, it's the wonderful people around you. People in medical school, we all came here for the same reason to help other people, right? And so you really understand they know how to help you too in those times. And it's just wonderful having a social and community context whenever it comes to any source of burnout. All right, you can't do medical school alone. So all in total, it's definitely the people that you're with. It's having other multiple interests and also coping with your workload. Just remember that you will always be working as an adult. Okay, so might as well just do what you love.
That was a great answer, by the way. You talked about like the type of environment and how like it kind of one of the main factors is like the people around you. How do you think that it changed from undergrad to medical school, like your environment and your surroundings? Do you think it positively like affected you or was it in like a negative effect?
I'll talk about for me specifically. It was wonderful. I love the people around me. The people in undergrad were wonderful people too. Those will be my closest friends for the rest of my life. But none of my friends in undergrad were pre-med. And so I would always be the one doing more work. And that sucks. You think you don't know if like you're like, am I dumb? Why is no one else working as much? And everyone kind of is like, Zeeshan, why are you doing medicine? Like, look at all of us having fun. You're not ever coming out with us. And I was always the kid that would stay at home. And so I love those people, and I'm definitely closer to them than I would be with the friends here. Because I met them first though. But the people here, when you meet someone of a similar background, it's just a different feeling. You feel so much more heard. Because imagine this, like Adele, you have a sister as a doctor. When she comes home and talks to your family, like it might be hard for her to always communicate her feelings, right? And that's the same with me, my family. Sometimes I don't voice how I'm feeling to my family or my people in undergrad, but here you can always, someone can empathize with you and you just feel like, I'm in a place where I don't feel like an oddball where I'm doing a career path that's just too much work. So it was honestly a wonderful turnover. I wouldn't say that's the case for every medical student, because a lot of people might be too far from home. They might be depressed for that, but my home is an hour away. You know what I'm saying? So, I thought it was a pleasant experience.
For students who are struggling with their mental health, do you have any advice for them?
It depends on what. Um, give me one thing to talk about because there's so many things someone could struggle with.
So maybe like struggling with like having high expectations for themselves, like
Yeah,
perfectionism.
just for more info, we also talk about perfectionism and like the
Mhm.
fear of failure too. And I feel like you being in the medical field is like a kind of a perfect example because you are around a lot of people that do set high expectations for themselves. And even with my
Mhm.
sister too, like Reba, she has a very big fear of failing. And I feel like that standard is also put a lot on med
Mhm.
students, if that makes sense. What advice would you say you have for specifically youth, but also just people in our community that are struggling with their mental health, specifically perfectionism?
That's so real. I mean, we all went to some sort of Troy school. Troy schools are very rigorous. You'll start comparing yourself to other people from the day you're born, in terms of an academic sense. And when I came here, I think that was my biggest sense of stress. Um, I don't think the people around here know this. They will never know because you guys won't get to them, hopefully. But if you guys pull up, that would be great. Um, it was so bad for me. I was, Adil, like you were always like putting your hands through my hair. You love my hair. I was losing hair. It was like getting bald spots. Like I'm like even she's reacting. And if you like saw the bathtub after I took a shower, it was coated with hair. And I was like, oh.
Gee.
So it was all comparison. The people around me are wonderful, but they're also very gifted. And they're very diligent. And um, it's not even like a specific thing. It's this you just compare yourself so much because I guess it's just natural because it is a competitive field. You
Mhm.
are versing other people at the end of the day. So you're probably going to do that. And two things helped me the most. One, therapy. I've been going to a therapist for a while. And the biggest thing, two things she would say. She said, you know, I'll start with the first thing. She realized that was the sole basis of a lot of my anxiety. It's just always what other people are doing, right? And through a lot of practice and mindfulness of, I'll talk about mindfulness in a second, it was just really understanding that as long as I'm passing, as long as I'm getting the grade I want, all side thought is negligible. You don't have to think about it. For example, let's say this. Let's say Adil, you had a nice car, and then I had a car that I liked too. Okay, but it wasn't as nice. And I compared in my head, like, oh, like, but your car, his car is nicer. But then I try to cope with it in my head, like, oh, but my car, like, at least it's cheaper. I'm saving money. And I would kind of go the second route, like, oh, at least my car is cheaper, right? And I'll be like, oh, at least I'm doing this, so at least I'm doing this. Eliminate the whole comparison. Don't even compare it in the first place. Don't, if you like, let's say like your friend has a nice shirt and you like it more than yours and you're comparing it to your shirt, and you're like, well, at least I got mine as a on a like in a cheaper price. You're like, okay, I won. Don't even do that. Even if you're doing better than another person, don't even compare it then. Basically, my point is that people might cope with comparing themselves with other people by like saying like at least I am doing still this XYZ, but don't even do that. Just try to keep your mind blank. That in total is mindfulness. Mindfulness is just being present of the current situation. What are you doing right now? Are we safe? The biggest thing is, are we safe? Because of course, if you compare yourself, you raise cortisol, you probably raise epinephrine, probably get really stressed out. The biggest thing to remind yourself is I'm in a safe situation. I'm doing okay. Just move on. Don't even bother thinking about other people. That's one thing that helped me a lot. The second thing, this saved me. My friend was like, I do that a lot. I compare myself, but if later down the road I find out I was this stressed for this reason, and I this impacted my academic studies because I was comparing myself, I would be pissed. And as adult as that sounds, as like invalidating feelings as that sounds, I started doing it. And let me tell you, even if it's an invalidation of a feeling type of thing, I am 30 times happier. I'm calm. My hair does not, even if I do an all-nighter, my hair doesn't fall out because I'm so like not stressed. Perfectionism, the sole basis of it, I'd say, is comparison. Because what does perfect mean? It's all is a relative thing. I'm saying you might be perfect here, but you're not perfect here. But you know what? Just if you're struggling with perfectionism, just ask yourself, am I happy with where I am? Yeah. Okay. Doesn't matter what anyone else is doing. Don't even think of it. Like, don't even think of it. Even if you're doing better than somebody, don't even think of it because you're going to get in a pattern of comparing yourself anyways. And the second thing is that every time you feed into that negative thought pattern and you're like, no, no, this is important to me. I have to think about this. Just remember your future self will be so sad that you did that because then your future is affected too. So that's how I kind of cope with perfectionism.
I was going to say, oh my God, you took, I don't think you realized like that, you took the answer right out of my mouth. We just had a podcast earlier and I was talking about the exact same thing on like comparing yourself. And I also feel like a good, like, I guess advice for that too would just like, Bisma also told me this too, like my sister, which is really good advice, just kind of realizing that I feel like all each of us are like in different levels of life and we
Mhm,
all have different processes. There's always going to be someone who's going to be better than you. There's
Mhm.
always, even though there's no point in like comparing that, but there's always
mhm,
going to be someone who is going to be better than you and just realizing we're all human and we're all in different levels and we're trying to process things. She would always
mhm,
tell me that like everyone is going through their own things.
mhm,
Like
mhm,
everyone is going through their own struggles. So like when you're comparing yourself to someone else and like, maybe their life isn't really that perfect and
Right.
that is, I feel like a very big thing as well.
That's true.
Some people aren't going through struggles. Some people are living it very good.
Hmm.
Don't even compare yourself to them, right? So that's another thing to focus on, you know. But it's a very good point. Everyone's going through their own struggles, but I want to add is that even if you're in a group that people aren't struggling, which I felt like with the people around me, and of course that's just me looking at them with no deeper understanding of who they are, but like from how I would look at them, they didn't feel like they had any struggles. But don't even compare them. Don't even compare yourself to them. I hope that makes sense.
So let's wrap this up with any words of wisdom you have to our audience.
I think the words of wisdom would really just be this last question you asked me because it applies to every career. It applies to everything you've ever done. Um, because if you don't compare yourself, then you can focus on yourself. You can focus on self-growth. Because self-growth doesn't come from chasing other people, right? Because what happens if you have no one else to compare yourself to? Well, you're just gonna stop growing. So it's really important to don't compare yourself in any way. And then you can sit there and be like, okay, well, am I happy with myself? Right. And it's just and then it's just not even a battle between you and yourself, because a lot of people like to be like you're fighting your own demons. No, you have to lock in. You don't have to make it so negative or so toxic. You can be like, this is an opportunity for me to grow. And I assume this is going out to the younger population. If it's the older one, if you're not happy with yourself, what are we gonna do? I'm kidding. No, that's they can get better too. If you're like so unhappy where you are in life, there's so much potential for growth. Um, Make sure you don't put all your eggs in one basket in terms of your passions, because if one passion goes through the roof, you have many other to fall back on.
Mhm.
Um, your health is your number one priority. Because when it came to me losing my hair, it was devastating. Because that was also another thing. I put all my passion into my hair because when I was injured for a while, I couldn't work out or exercise, so I had no really any confidence in myself. So I all depended on my hair, and then I lost my hair. Then I
Right.
lost my hair. But then I put all my confidence into my hair, right? So don't put your eggs in one basket for any part of your life, because if that falls through, you'll feel even worse. If you are interested in the medical career, it's a wonderful career. I'm one saying this, and a lot of people disagree, um, who are older than me. But as an M1, I'll tell you, I love it. I have no regrets. I have no regrets. I have been in so much mental fatigue in my life from this career, but I have no regrets. Last thing is 1% better every day. You're not going to reach your goals in a day. And everyone hears this. Everyone hears. But one thing that I want to emphasize is there is a reason every person older than you is saying this, right? One day just sit back and go like, okay, let me listen to what these millennials or older Gen Zers are saying. All right, there's a reason why everyone says this stuff, and take a step back, listen to it, and reiterating what I was saying, 1% better every day. If you're not able to make your bed every morning, okay, at least set your pillow. Okay, if you're not able to stick with your skincare routine, just do one part of it, etc. But yeah, that
I have one more question and I'm gonna like try to keep it short, but This is just really out of pure curiosity too. What do you, in your opinion, what do you think, like, in your opinion, is the biggest misconception with mental health? I talked about like mental health with men and like how men tend to hide their emotions more because of like, like toxic masculinity. And I feel like a definitely big pushing risk factor for that is like the type of culture or the religion you are. So, in your opinion, what do you think is the biggest misconception in mental health?
I think the biggest one is that people get angry, especially specifically girls, I mean they're valid. They get angry at men for not talking about their feelings because they think the man is doing it to be more manly. A lot of the times a man is just not programmed to talk about their feelings. It's like I was reluctant to ever seek professional help. Not because I was like, this is not manly. I just was like, why? Even though I would recommend it to other people, I was like, no, but for me, I'm fine. Right. And I think it's a big thing where like people assume men are people who want to bottle their stuff in, but they're just naturally doing it, right? It's not always like a deliberate thing of like, no, that's like too feminine to go talk about your feelings. So I would say that's a misconception of men. I say that because for all the men, the young men listening out there, or even the young women who are interested, just know that you might be bottling up something, and be mindful of if that's the case because if you bottle up something, we all know what happens maybe like a year later, 2 years later, you just might explode. And you might not ever explode, but it will affect you. So just keep that in mind for like the young men out there who are avoidant of therapy, or avoidant of any mental health discussion, or avoidant of any mindfulness.
Hmm. Okay.
Um,
Thank you so much for coming
Mhm.
on this podcast and being here and talking about mental health with us and kind of
yeah.
your background and what you want to do.
So much for
Awesome.
sharing your experiences and your obviously words of wisdom and advice to our viewers. And thank you guys so much to the
There is
audience.
three,
Thank
bro.
you guys so much for listening to this episode. You guys know where to find us at Perfectly Imperfect
Perfect dot
Hosa
hosa.
on YouTube, Instagram, everything else. Thank you guys so much for your support, and we hope that you guys liked this episode. Bye, guys.